Easy, easy.
Hi, my name is Jay Ilagan. I'm a fourth year medical student from the Ateneo School of Medicine and Public Health. And as a fourth year medical student, we're also known as medical clerks. And as clerks, it's supposed to be like the start of when we actually get exposed na do rotations in the hospital. And that was if the pandemic never happened. But since the pandemic actually happened and people weren't allowed to go out of their houses, stuff like that, everyone had to transition to online classes. Luckily, in Feb, no, with the number of cases going down and things started to become it started to become more safe as compared to the previous months. They allowed us to go back to class, to do physical rotations already. We learned how to insert the mga IV, how to draw blood, all those things that you need to know how to do when you step into the hospital. It was funny because parang when we got there, the hospital didn't expect na parang nasanay na sila na wala kami. So it felt like it's like what was needed of us was very minimal na. So a lot of the things that we do is actually just observing our doctors, the residents, the consultants, and especially if it's like, let's say a COVID case or something like that, they wouldn't allow us to go there. But how it like went was normally kasi pag non-pandemic duty, it's like 24 hours or 36 hours in duty. But the way they changed it up was it became 8 hours lang. Or depending on the department that you're with, sometimes 4 hours lang. And usually it's not every day pa. So it's every other day or 2 times a week lang because they want to keep the number of people, the number of clerks in the hospital at a minimum. It is so weird because like when we stepped in, it's like nothing has changed. This is like a time capsule na if you look at the blackboards, there were some blackboards pa na nakasulat yung schedule namin doon from March 2020 before the pandemic hit, and no one ever cared to erase it. So it was so weird to see that schedule like 1 year after. It was really sad though because we couldn't touch each other. These protocols set in place na there's this unidirectional flow of foot traffic. So you're not allowed to enter through the entrance. You actually enter through the back and then you exit through the entrance. They put up these parang barriers, parang one way lang yung flow ng traffic. Diba there's this parang rule na dapat below 50% operating capacity yung building. So they didn't allow all the batches to come back. It's like one batch at a time. And that one batch would be scattered throughout the building para in each classroom konti lang yung tao. We had to sit 1 or 2 seats apart per classroom, depending on what classroom it was. And on the first day of our like face-to-face class, they gave us na PPEs, they gave us masks, they gave us face shields, and yung unang bigay nila. And then it was supposed to be like replenished every month. But we only got like 1 extra replenishment kasi nga nag-pull out kami. But yeah, that's how everything was. I don't think the admin really forced anyone to go back to face-to-face naman. They were very careful with making us sign mga co-accountability forms and informed consents to make sure that we knew what we were involving ourselves with. They started to plan it out mga June when we got into clerkship na, they were telling us na, okay, so this is how it's gonna go. For the first semester, it will be all online. But for second semester, we're hoping that if the number of cases go down, etc. And yun nga, start of second semester, we did our clinical skills module. And going back to school, seeing everyone so happy talaga because everyone, we love our campus. it's like second or third home to us. Diba, this is clerkship year. This is the year that we're supposed to be in the hospital. So majority of us weren't really scared. Siguro, if any, yung apprehensions namin is more of the associated costs that go together with, going back to the hospital, because for online classes before, you can basically do online class anywhere. If you live in the province, you can do online classes there, diba? As long as you have internet. For me, kasi I live here in Metro Manila, so getting a condo or something wasn't a priority for me. But for other people who had to plan it out, kasi a lot of them already canceled their like rental fees or yung mga contracts nila because of the pandemic and they had to fly home. So that was the hard part. Having to set up your life to get ready to go back to the hospital while at the same time still doing your small group discussions and online classes. But eventually naman everyone was able to do it. All of our interactions with patients, all of our interactions with our doctors were done through online classes. And what we do, depending on our schedule for that week, is we conduct small group discussions, or SGDs, as what we call it. And basically what goes on in SGD is we discuss the patient's case. They either give us a case beforehand and then we study it and then we present it to them on the day of the SGD. Or if they want, some thrill, they give it on the spot and then we discuss it. And from there, we go through the whole case. We look at the history of the patient. We look at the physical exam findings of the patient. And then we try to come up with a certain narrative. Parang, does this person need to go to surgery? Why or why not? What medications will you give to this patient? And why will you give this? Why will you give that? So basically, that's what goes on naman din in the hospital setting, if we had this face-to-face. But the difference lang is, instead of us talking to the patient and gathering information from the patient mismo, it's all just from a paper. Other people naman kasi, depending on what their strength is as a learner, sometimes they can just listen to something and then gets na nila. Sometimes they just read the book, gets na nila. But for me, I learn best with practice and experience and physically touching stuff. Partly why I want to maybe be in the future, like be a surgeon or something, because it's very hands-on. And that aspect of physical face-to-face learning, you're not able to fully maximize when you're in online class. Sad to say, pero with online class, it was really more of like going through the motions lang. Okay, here's a case, this is what we'll do. After the SCD is done, pasok dito, labas dito. Didn't really learn much. I mean, we did learn, but in the sticking to our brain, parang hirap ng retention. And of course, like talking to other doctors, talking to residents. That type of interaction you don't get in online class. Yung mga kwentuhan lang pero madami kayo nalalearn. And you actually get to see, so this is how this machine works pala. I read this lang in the book But yun pala, if you do this, if you touch it like this, there's a certain technique to it. Those little things, those little intricacies, you don't notice, or you're not able to utilize in online class. Yeah. As a medical clerk, super lucky that we were included in the list of, I think, A1 priority list. Parang ganun A1, A2, A3. I personally got AstraZeneca, partly because nawalan ng stock ng Sinovac that day or something like that. But, my decision was to get AstraZeneca. Even if mas known yung side effects, na it's higher likelihood, especially if you're young, to get fever or like pain in your injection site. Like I got mine here in the left, or like body aches, ganon. But to me, I wasn't really scared of that. I actually wanted to get the side effects because it was physical proof na gumagana yung vaccine. But it doesn't really mean naman if walang side effect, hindi gumana. Diba? Basically, so we had to sign up and then we had to go there on the day that we were scheduled to go there. And then kasabay namin was anyone, yung mga naka-line up, like literally anyone, like doctors, nurses, security guards, janitors, really anyone who was working in the hospital. And I waited for an hour, like from the moment I stepped into the back of the line until I got my shot. It was like around an hour 30 minutes. But the whole process is very organized. They ask you a lot of questions to see if you have allergies, if you have any comorbidities. Then after that, you get called to do the vaccine na. And the whole vaccine, yung pagturok mismo is like, I don't know, like 5 seconds lang. It just goes in and out. And it literally doesn't hurt at all. Like I didn't even feel it. The benefits still outweigh the risks of getting vaccinated. There's this talk about, blood clots. People are so scared about AstraZeneca getting blood clots. I saw this infographic before, a credible infographic. There are certain things that if you do have higher chances of you getting blood clots than the AstraZeneca vaccine. So, to me, I haven't received my second dose yet. I'll receive it end of May, start of June. And knowing the risks and stuff, I think it's like 1 in 1 million lang yung risk. I think it's very, very, very low. I would still take my second shot, and I encourage everyone to do the same thing. Get vaccinated as well.